James, welcome to the show.
Great to be here with you. Thanks for having me.
You have some really interesting theories and proving to be realities in terms of where things are headed with medicine. Did you have an experience yourself that pointed out some of the flaws in the current Western medical paradigm, or what was it that kind of got you down this path?
Yeah, so I was the weird kid at school that did natural medicine, and so I had a chiropractor growing up. I was born in America, and then I moved to England, and I didn't realize that any of that was weird until I went to school and realized no one knew what that was. And then the one thing that really stuck with me was that I was the only kid in school where my mother insisted that the nurse would call her before administering antibiotics. Right. So here's my mom with no medical training in 1985, predicting the downside of overuse of antibiotics by 30 years. Right. So that stuck with me in my head. It's like, how did my mom know that? Like, when I was now at university studying health economics, and I could see, okay, there were these big problems, antibiotic resistance was coming, and now there was like the return on investment in American medicine was so low. I was like, what did they know that I didn't know? And that sort of left my abrupt departure from sort of like normal job. I was an investment banker for a year, and I moved to America. Luckily, I had the passport because I was born here, and I just jumped straight into the front lines, the trenches of health creation, into a practice that was sort of like a model for the future of primary care, combining naturopathic medicine and kind of a spa environment.
Okay, I like it.
I'm just gonna get my plug in. Here we go. I've got the real mic now. Here we go.
That sounds like rich mahogany. Nice. So your passion was health. It sounded like you were going to see natural doctors as a kid.
Yeah, I had a homeopath, and I didn't really use any conventional medication. I had the super healthy, disgusting cough syrup, all of that stuff. And I just, that was just the way I did it. And, I just started to look out into the world and see where the biggest problem was. And I could see that chronic disease and the cost of medicine, the cost of health was a massive problem. I was a health economist, look across all the countries. I grew up in the UK, right? So in the UK, you've got you've got a completely different system, right? You've got a completely different way that health is paid for, but they're running out of money. And then in the US, you've got a completely different system. You've got the National Health Service versus completely capitalist system and running out of money, ridiculously low return on investment, like America, 65th in infant mortality, below Cuba and Serbia and Peru. And I'm like, what's going on here? There's a massive problem. And I just had a feeling that something to do with my childhood could have a solution, but I didn't really know what it was. So I worked in a clinic. I started to see firsthand that people could recover from these chronic diseases that people thought were incurable. I was watching it happen. Autoimmune diseases being reversed, type 2 diabetes being reversed. These were things that no one had seen. Then I started becoming a rep for a supplement company that only sold to doctors. And then I saw it even more and more acutely with things like Lyme disease. No one even knew what that was. This is back in 2007. No one knew what it was, but I could see people getting better from it. No one even knew that chronic Lyme was a thing, but I was way down the rabbit hole. I saw kids lose their autism diagnosis. This was even before people knew about autism, right? In a certain way, if you believe certain people, they say, oh, it's just, we know about it more. Well, in 2007, then no one knew about it because it's multiplied X number of times since then. Yeah. So I was seeing things I didn't know were possible. And then I started to realize, look, there's a misalignment of medical systems, where the medical system that was created, that's based on drugs and surgery, was created for an era of medicine that no longer exists. And that we needed a new era of medicine that was designed around these types of diseases that were largely environmental and largely lifestyle driven. And that was the beginning of the evolution of medicine. So it started with a show. I created the first conference for doctors that was online and for free, called the Functional Forum. We just had our 50th episode in March. And our first goal was to build, this is for like 100x the number of doctors that were trained in functional medicine. And so, we picked Functional Forum as the name, and we picked functional medicine for a number of reasons. One, everyone does it the same. Naturopathic, integrated medicine, these other sort of, disciplines of alternative, unconventional medicine. One of the big problems is everyone's doing it their own way, which does not help with scaling up. It's good, it's an art and a science, but it doesn't help with scaling up. And then, functional medicine also had, sort of like an energy and momentum that I thought was really valuable. And then on the fourth show of our show, Mark Hyman came on and announced the Cleveland Clinic deal. So now it was like, okay, now we see that we picked the right horse, because this is going to go, and like now there's going to be mainstream recognition. And so it's just been an amazing journey, ever since then, building the ranks, bringing doctors from conventional medicine to functional medicine, initially just giving them the clinical information they needed, and so sparking their interest through free content. Then we started building a ton of communities. So we got 500 meetup groups for doctors around the world around the monthly show. And then I wrote a book called The Evolution of Medicine that was really to, again, reduce the barriers to entry, this time around practice development, because I realized that you didn't need as much stuff as you used to need to run a practice, right? You could run most of it off a laptop. You could prescribe the supplements. You could have a mobile phlebotomist do the blood draws. You could do your appointment booking and education online. So we started to help people build this sort of a new type of practice. And, that's what we've been up to for the last 5 years.
Very cool. For someone who is not familiar with the difference between Western medicine or conventional medicine and functional medicine, how do you describe that?
Well, look, you better recognize, because if you're a biohacker and you listen to a biohacker podcast, let me tell you how it normally goes down.
Have your ducks in a row before you show up.
Biohack, you understand your body. You really understand your uniqueness. Maybe you've got a continuous glucose monitor and you see what foods are for you and what foods aren't. And then you go into the doctor's office and you start to have this conversation, and they start to glaze over because they realize you know way more than they do about all of this. And this is not a good position for them to be in. And maybe they're rude. Maybe they kick you out of their practice. That's like, best case scenario. So like I've seen that a million times. Like doctors don't know anything about nutrition and lifestyle. So basically functional medicine is a medical operating system that honors, the body is an interconnected system, right? So that the heart and the brain and the lungs and all the different systems are interconnected and need to be treated as such. And that's why they're more of like a super generalist than a specialist, right? So that's the first thing. Second, they're looking for the root cause of dysfunction. So they're not just going to give you drugs to paper over the symptoms, but they're going to actually try and understand what the root cause is. And in a lot of cases, it's lifestyle and chronic inflammation and all that stuff. And then, and then the third, they require patients to be an active participant in their care, right? So it's not just like, oh, give me the medicine, doc. It's like, hey, doc, what should I be doing to reduce my blood glucose, to reduce my hemoglobin A1C? So it's a different thinking process. Like the patient is in control and the doctor is more of a guide. So that's what functional medicine is. It has many different roots, but ultimately the thing that separates it is that it's a consistent system where most doctors are doing it the same way. There's sort of a consistent intaking, there's a consistent prioritization for the specific patient. And then, and as I said, the big differentiator is going to become from this Cleveland Clinic study, where now the most credible organization in the world is going to say, yeah, functional medicine rocks, and it's better outcomes at lower cost for a range of chronic diseases. And then, then we're off to the races.
It's interesting to me that like this distinction between a generalist and a specialist, because I think we're trained to hear specialist and think, oh, that's better. And yet it's almost like kind of a funny example is like when the UFC first started, you'd have like a karate guy fighting a wrestler, or like fighting, a jiu-jitsu guy fighting a boxer. It was specialists going in there. And then someone would come in that knew how to wrestle and box, and they'd start messing people up. And until eventually now people know every discipline, or at least the disciplines that are most effective when applied in the cage. And it's kind of like functional medicine, where people are now saying, okay, what are the different aspects of a variety of disciplines where I'm not pigeonholed to Western medicine, and how can I apply those to the patient in a way that gets better, less expensive results?
Yeah, I really agree with that. I think it's a good analogy. Like you've probably guys seen, there's been a ton of research recently linking Alzheimer's and brain diseases to lifestyle. So, some people get Alzheimer's because they've been near an aluminium smelter for their whole job. And some people get it because they have uncontrolled type 2 diabetes, uncontrolled blood pressure, blood sugar and inflammation. And so, and it's because of what they eat. So like a neurologist cannot solve that problem. If it's that you've been eating the wrong thing for 20 years, just like you're just addicted to sugar and brain's been shrinking because of like a type 3 diabetes effect, the neurologist has no skills to be able to resolve that.
Yeah.
It's arguable whether a neurologist has any tools at all to resolve anything, because then that's a joke even in medicine, right? Amongst the doctors, that the neurologists do all the great diagnosis, but then have no tools to actually reverse anything.
Yeah.
And you see, like Dale Bredesen's book, The End of Alzheimer's, was a top best-selling book. Mark Hyman's recent Broken Brain series was massive. 500,000 people watched it. So, that people are starting to realize that, that there are tools that we can use to be able to reverse these kind of things. And it's all functional medicine. Everything's coming up functional because, Alzheimer's is not one disease, it's 5 diseases. Type 2 diabetes is not one disease, it's 5 diseases. And the skill is to be able to identify what is the root cause that's causing the brain shrinkage, the plaque development, or the lack of insulin sensitivity, and then remove that root cause. And that's what functional medicine doctors are great at.
And what are some of the biggest problems you see right now in Western medicine? You talked about the contrast between treating symptoms and treating the root cause. What else is going on with Western medicine as it exists today that's holding us back?
I mean, everything. I mean, the way that it's paid for, the way that it's delivered, it's just old thinking, man. You can't, like look at a hospital. You got people who hate their job. You got no windows, you got terrible lighting, you've got like people smoking out the front. These are not bastions of health creation. Like health is being created in CrossFits. Health is being created in like community centers. Health is being created in kitchens. Like that's where long-term health is being created. Medicine cannot adapt. So we started out with the concept that medicine was going to evolve, right? It was going to adapt into this new structure. It was going to evolve for these new diseases, right? There was a different environment and it was going to evolve. But what we saw is that it's not going to evolve. It's going to have to be a new system because it's set in an infrastructure that doesn't allow it to evolve. You've got the fiduciary responsibilities of the insurance companies, the pharmaceutical companies, and the hospital companies, where they have to make more money year on year. That's literally the only point of their organizations once they're a public company, right? The CEO is bound to that as the number one priority, is the return on investment to shareholders. So it's very difficult for them to innovate. It's very difficult for them to take another track. One of the reasons why the Cleveland Clinic did it is they saw the writing on the wall, which is that in the future, people are going to get paid for outcomes and not get paid for just volume. And so they went ahead of the curve to come after functional medicine because they saw that writing on the wall. But everyone else's CEO is employed, year to year, and they're responsible for outcomes year to year of like the bottom line. And they just don't think that far ahead. So the way that it's paid for is a problem. The way that it's delivered a problem. It's not convenient. Just think about it like this: like if you're even just the thing that they're best at, right, which is acute disease. Let's say you get an infection. The whole point that when you get an infection, which is a transmissible thing in some cases, that you have to go into a place with a bunch of other people is ridiculous. It's ridiculous that that's the plan. Right. Ultimately you see things like telemedicine, where people can now be treated in their home. That's the future. But how quickly things will adapt, I don't know. But what we're doing is we're building the new healthcare system from scratch, designed around lifestyle disease, because we realize that that's what needs to happen. So it's the functional medicine doctors, it's the coaches, it's the payer system, all of that. Like that's what I've been doing for the last little while. Like I used to be kind of like an activist, and I would be like, oh, do you know where medicine, why it's screwing us all over? And like, these guys are taking control, whatever. And about 5 years ago, based on a couple of experiences and one quote, there's this great Bucky Fuller quote where he says, you don't create change by fighting the existing reality. To create change, you have to build the new system that makes the existing system obsolete. Right. And I was just like, bang, that's what I want to do. And so that's why we started the Functional Forum. Let's build an army of doctors that could do functional medicine. Let's teach them how to work in conjunction with health coaches, so that, the functional medicine doctor is way too overpriced and way too overqualified to be teaching people how to eat better. Right. That could be done by a $30 an hour health coach. So, that's what we've been looking at systems, looking at community, right? Community is the most underappreciated biohacking secret of all. Here's my biggest tip is that if you are a biohacker or if you're someone who wants to get healthy, the best thing that you could ever do is to meet a bunch of other people who want the same thing, because you need to develop your new social structures. People who want to get healthy typically have to extricate themselves from their current social structures, just like people who don't want to drink booze anymore can't go to the bar with their friends. People who don't want to eat sugar anymore can't, participate in the office donut Friday, And so that's why organizations like CrossFit, have such loyal followings, is because when you become into the CrossFit fold, you're exercising together, you're developing new friendships, you're eating paleo potlucks together. There's a whole culture that emerges from it. So there's also research to show that in this new field of human social genomics, that social stress is actually the biggest driver of all-cause mortality, more than smoking, more than lack of exercise, more than food. And so, the quality and quantity of our social relationships is a much better predictor of whether we'll die or when we'll die than anything else. And so, we've really focused our efforts on creating structures around these functional medicine practices where people who want to get healthy can be introduced to each other.
James, I need to pick your brain on this one, because I completely agree and have personally had a little bit of challenges. I moved to Florida in August and left behind family and friends. And I know the importance of community, and I've been going to certain yoga studios and trying to get out more and meet more like-minded people, but find myself, you don't want to go to bars and clubs. And sometimes yoga class, you roll in, you do a class and you're out. You mentioned CrossFit being a good one. Like, are there other ways that you've seen people successfully implement this, especially like in a new city or after they've had to separate themselves from their friends to get healthy?
I think you got to use online tools to create offline connections, right? So just imagine if you'd made that move 20 years ago, right? In 20 years ago, you have no idea who likes what. Right? Your best shot was to go to the health food store and see who's putting up a flyer. And that's a pretty long shot because there weren't any health food stores 20 years ago, or go to the library or whatever. Now there's Meetup, there's Facebook, there's Eventbrite. There's all these places where people are putting on events and are putting on those kind of things. There's even apps now, right? You've got Tinder for meeting, people of the opposite sex for dating. But a friend of mine in Venice started one for, parents and mums to meet each other, to find other cool mums to go on mum dates with. Oh. Right. So maybe there's going to be like a healthy version of that. But, there's all kinds of ways in which you can use online tools to create offline connection. That's what the internet's great for. Helps you filter each other into your communities. You can find different groups. So I think you find online tools, you find out where there's a meetup, and then start going to, events where there's those kind of people. But, we've encouraged our doctors to do that kind of thing, like a walking tour where, people are getting together in a walking group, or cooking groups where people are like, one of the coolest ideas that I've heard, which we've helped to popularize, is this idea of community batch cooking, where groups of people can batch cook all their food for a week in a group. So like 5 people get together, you go to a house with the biggest stove, or in some cases I've seen people will like meet together on a Monday night when a restaurant's closed and use the commercial kitchen. Oh. And then cook all their meals for the whole week in like 90 minutes. And so, the old thing of like, oh, I don't have time to cook, eat healthy. Well, that's because you're warming up the pan every night and chopping the vegetables every night. And like, you don't have to do that. And you could make, if I like chicken stir fry and you like chicken stir fry and everyone in our community likes it, why don't I make a massive one and then we'll split it into Tupperware and do it. Like those kind of economics, that kind of community building. And so, the one thing I would say is if you're still not finding it after you've searched around, then it just comes down to initiative, because there are other people that are looking at it too. So now it's just like, okay, why don't I put on a community walking event and put it up on Eventbrite for free and see who shows up? People are looking on Eventbrite for events. It's free to put up events. 2 million people a month go to book tickets on that thing. So, there's millions of people, and way more people are visiting it just looking for stuff in their community. So that's kind of what I've seen is that there's, ways to do that. I moved across the country 3 years ago too. And, it was through participating in certain other communities that I, met a lot of people. So by the time I moved to Venice Beach, I actually knew, 2 or 3 dozen people moving from New York. And, that was really great to sort of have a preset community, but that's because I've been sort of like being in communities of people and meeting people who lived here for a few years before.
Oh, that's real cool. That's a good idea with the batch cooking as a community. It makes it a lot more fun. I could see women even like, maybe having a glass of wine or two. I do something similar with my supplements. I just put them in like plastic cups with a lid, and I'll do like 2 weeks at a time, so that all I got to do is grab it, shoot the supplements, take it with a little bit of water, and same thing. You're not pulling out, your vitamins every day.
Yeah, no, exactly. Well, I'm sure you got a pretty aggressive regime if that's what if you need it to that degree. But I mean, I'm not surprised. But yeah, look, that's cool. I think whatever makes it easier. But I think there's something about the community element that holds people accountable. A couple of years ago, my mother-in-law lost 110 pounds. And the only thing that she did different was that she had to call someone at the end of every day, an accountability buddy, for free, and tell them what she'd eaten. And so she was so like, even though this was basically a stranger at the beginning, she was so, she was so determined not to say, I lost it, I went to McDonald's and got 4 Happy Meals, like that. She changed her behavior, and that was what changed it. It wasn't like, oh, I'm just going to eat better, I'm going to will my way through it. It was like a accountability to a random stranger, and that's pretty cool.
Yeah, it's funny how much stronger we get when we're doing it for someone else rather than ourselves. It's like real easy for us to let ourselves down, probably easier than to let down a stranger in that case. James,
Yeah.
what are you most excited for as you see medicine evolving, and like, where's your place in that evolution?
Well, it's good timing to ask me that, because, over the last few years, as you start to continually execute projects and you build a team, and I've got 2 companies now, you just get a sort of a bigger idea of what you could do, right? What could I do with all these doctors now that kind of trust me, and with all these health coaches that are really so thankful that I've been like doing them, and the team that I brought on, and the sort of momentum that we have. And so I'm here today to tell you that we're going to go for the jugular this year. We're going to try and actually create a new health system that makes the existing system obsolete this year. And the piece that's been missing has been the payer, right? So I'm sure if you're listening to this, and I know you've had a personal experience with this yourself, if you're a biohacker, if you take care of your health, if you've been proactive and preventive with your health, it's annoying to pay a lot of money for insurance you don't use, right? You're not going to go to that doctor because he already embarrassed himself in his first appointment when he realized he didn't know anything about nutrition or exercise, right? So you have that kind of situation where, you're not using it, and, the chances of you getting hit by a car are small, but, ultimately you want to be covered, but you'd rather just, you'd rather not, give $500 a month to Aetna, for something you're never going to use. And it just looks like a big part of your wallet share. It starts to get almost as big as your rent payment. And then you're just like, what is this? And it's only going to go up more because now the ACA has been defunded. And so like where people have been experiencing 20 or 30% increases, which is ridiculous, by the way, 20 or 30 is not okay. It's going to be like 40 to 70 next year. And so if you're paying 500 this year, next year is going to be 800. And you'd be like, that's like your mortgage payment. So that's what's about to happen. So yeah, so we're going to do something totally awesome this year, which is we're going to start our own health cost sharing cooperative. Now, this was not allowed up until January 2nd because you had to have ACA compliant health insurance from one of the big five. I mean, what the ACA was just, imagine you're an insurance company. I mean, you can see the numbers. If you look at the share prices of all the big five from like 2008 compared to 2018, there's like a 10x increase. Like these companies did so well. Why? Because ACA forced everyone to buy a commercial insurance product. Like that may seem like progressive politics to people in America. That seems absolutely insane to me, right? That a progressive politics in this country is that we're going to force people under tax penalty to buy a commercial product. It's ridiculous. It's a scam. So I'm like, okay, we're going to do something about it. So 3 years ago, at my second summit, I was part of a crew. My friend Tom Blue actually started this thing called Liberty Direct, which was a health cost sharing cooperative built on this Christian health cost sharing cooperative. There were 4 of these Christian health cost sharing cooperatives that got an exemption to the mandate: Liberty Health Share, MediShare, Samaritans, and one more. And ultimately, you have to be super Christian to be in most of them. Liberty is the one that is not so Christian, but you could be any denomination from any state. And so he built this product. Now I signed up for it. And honestly, it's been awesome for me because, I have a healthy family of 3. I pay $4.49 a month, and I have for the last 5 years, compared to, everyone else has gone skyrocketing. With everything else, I'd have to pay way over $1,000 a month right now to get the, with the worst deductible, the crappiest care. So now I'm paying $4.49 a month. I've never had to use it because I'm, healthy. There's a little bit of a sort of a deductible. So like, but I've, myself and my family have been healthy, but I'm saving that much money every month that I can use to go and see the chiropractor or the acupuncturist or get supplements or whatever, because I'm saving that much money. So Liberty is cool. And you can sign up for Liberty Health Share right now. For all the people listening, you can go to libertyhealthshare.org and you can sign up. You don't have to wait for open enrollment. You can cancel your credit card that's paying for your health insurance, and you can just opt out. And up until January 1st, that was your only option, because those 4 just happened to put their hand up at the right time when the ACA was being made. But on January 2nd,
what is the ACA?
The Affordable Care Act.
Okay.
Yeah, the Affordable Care Act, which is like Obamacare.
Okay.
Right? So that is the ACA. So that's the sort of the law of the land when it comes to health insurance.
Okay.
So on the 2nd of January, in Trump's tax bill, he got rid of the tax penalty for not having insurance. Just got rid of it. And what that basically means to anyone else, that means like nothing. I don't know. Thank you if you don't have health insurance or whatever. But for me, that means that anyone can start their own health cost sharing cooperative. And I've been waiting to start my own for 3 years because I love the concept of it. I'm not totally in love with the sort of, it's quite opaque. You don't really know what's going on under the hood at Liberty Health Share. I mean, my things have stayed the same. And I've had friends who have, had accidents or others that have made claims and have been paid. So, I'm confident to a certain degree that that's cool. But we're going to do an awesome one where functional medicine is just going to be the default care inside our thing. And ultimately, the coolest thing about the cooperative is that it incentivizes everyone in the cooperative to help each other out, right? To support each other. If you join and you now get all of the people in your cooperative, in your cooking group to join too, and everyone's healthy and helping each other eat the anti-inflammatory meals, the chances of anyone in your group getting like an autoimmune disease, if everyone's eating healthy, or, which the autoimmune disease, people think that it's like an accident that like that makes healthcare costs go up. It's not at all. It's people being on long-term expensive medication, like Humira costs $50,000 a year. So if you get put on Humira, that's, if you get 100 people who get put on Humira, that's how insurance goes up. 86% of costs are spent on chronic disease, not accidents and acute disease. So, so ultimately we're going to create kind of a health insurance alternative for healthy people. Functional medicine will be the default care. And we expect it to cost somewhere between $130 to $190 a month. And, if you get in an accident, you will be covered completely. And, we're going to suck all the healthy people out of the system. And, we're going to get to a point where we have a seat at the table at any future negotiations, because there's no way that Trump is going to put in any other, he's not going to put in any other rules between now and then. And so, so it's called New Health is our new project, new with a K. You can go to newhealth.com. And to launch this, actually later this year, we're going to do what we're calling the New Vision Tour, which is a 40-city tour around the country, to essentially get people fired up about this idea, to get all the functional medicine doctors locked into our system, and to build this new model. And we've basically got a 3-year window between now and January 20th, 2021, when President Oprah takes over and goes back towards single payer, to be able to make enough of a dent in medicine that, we have a seat at the table for whatever the next iteration of negotiations looks like about where healthcare is going to go from here. But I can tell you right now, look, that Amazon is getting involved and Apple's getting involved and all these companies are getting involved because they don't like what they see. They're annoyed with the current state of healthcare. So I assume that, solutions to medicine are not going to come from the government. They're going to come from these tech giants. And, I'm going to sort of stake my claim as part of that evolution.
It's amazing and inspiring. Do you anticipate any pushback from government organizations or agencies because of the potential loss for them?
No, not really. Not under this administration. It's like, people in the Republican side love this. Like Rand Paul loves this idea. Like Rand Paul's idea for changing medicine was to allow groups of people who weren't employers to come together and bargain for their insurance together. But the truth is, you don't need insurance, right? Here's the truth. Once you get to a pool of 10,000 people, right, it's the pool that covers the risk, not the individual. Right. So if you're just alone, like the way that the health system works now is they make everyone into their own individual island. Right. You're just one person and you're like, wow, if I get hit by a car, I can't afford 50 grand for an accident. So I better get insurance. Whereas what these health cost sharing cooperatives, these Christian groups did was to instigate the power of the community. There's like, if Anthony's in our tribe and we've got 50,000 people in our thing, and if he gets hit by a car and it costs 50 grand, are we all willing to chip in $1 for him? And the answer is yes, right? So then there's a community that sets its own intention about how they want to take care of each other, and they set up that agreement, and then, the plan just gets executed. And that's what we're talking about here, except in my system, it's going to be all executed, completely transparent by a new technology called blockchain that is going to facilitate like an open, transparent system where groups of people could start their own cooperative. They can set their own rules for what they will pay for and what they won't pay for. A lot of my female friends would never sign up for Liberty Health Share because it's Christian, like no birth control, no abortions, no, all that stuff, because it's a Christian thing. So like, I don't want that. Like I want women to be able to take advantage. I lived in New York and LA. Most women there think that birth control is fine. And so, I've got friends or whatever. So I want to create something that's a good fit for them. And so that's kind of, that's the purpose of what we're doing. It's got to be like non-denominational, completely open to anyone, but ultimately open to people who care about their health. Because the reason why it's so cheap is because everyone's healthy. Right? That's the reason why, because everyone's healthy or getting healthier, and you'll be rewarded in our system for getting healthier, losing weight, bringing down your hemoglobin A1C, bringing down your inflammation, bringing down your blood sugar, not smoking. So we'll have rewards built into the system to be able to help people get incentivized to get healthy and stay healthy. Because ultimately, if people get healthy and stay healthy, the costs within the pool stay manageable.
Yeah. And you can see like no one wants to be the weak link in the chain, or picked last, or the one that's dragging the group down. And even if they don't meet other people in their pool, there is sort of that, like you said, you're not just doing it for yourself. You're not just letting yourself down if you stop exercising and eat like crap.
Yeah, exactly. And that's why we're doing this tour, so that we can get, like, if there are the first 100 or 200 members that are in Houston, let's introduce them to each other. right? Let's put them in the same room. And if they meet a few that are the same, maybe they can start their health cost sharing cooperative. I mean, their cooking cooperative, or maybe they can do a walking group together. That's the plan. That's part of the power of this tour, is to get them in a group together, and then showcase the doctors on stage who are going to be part of our doctor cooperative. You're going to be delivering the care for the people in the community. And, that's where we're going. So if you want to find out more about the tour, you can go to newhealth.com/tour. You can buy tickets for the tour, or if you want to reserve your spot, you can go to newhealth.com and you can reserve your spot in the cost sharing cooperative. We're hoping to launch it in December, around the time that open enrollment starts. But this summer, we're going to just be recruiting people into it. And it's going to be totally awesome.
Very cool. newhealth.com/tour, TOUR. And last question, James, if you could only have one biohack, whether it's a supplement, and a lifestyle intervention, anything that brings you the most joy or most benefits to your health, what would it be?
It's got to be community. It's got to be a group of other people that care about the same things that you do, that hold you accountable, that help it make it easy for you. I mean, it is literally both scientifically proven at the cellular level. Look, the healthiest places in the world, the blue zones, right, where people live to 100, there's no great medical system there. They're not living to 100 because they've got precision surgery. They're doing it because they got communities of people that eat together, live together, pray together, play together, and that's what keeps them healthy. That is biohacking. That is an exponential technology that can be used at any time, is completely free, and is the future of medicine.
I love it. James Maskell, thank you, brother. This has been a lot of fun, and I'm excited for what you guys got coming up.
Thanks. Yeah, great to be here. And look, the biohackers are definitely on the front edge, tracking out, we're going to have some super cool technology where you can, track your progress. I think you asked earlier, what's the weakest point? It's also weak, right? There's so many pieces of biohacking that are so good, like tracking your thing, making it easy for you to get your data. Like that stuff has to be part of it. I really feel like we're making healthcare for young people. The old people, they're going to die anyway, right? And so we got to make stuff. So I don't think it's reasonable that the medical system would all be built around the doctor's needs. The patient's the most important person. Let's build it around the patient. It's going to be a beautiful app. It's going to be easy to get your health data. It's going to be easy to bring it all together into one place. What we see up until now is just so amateur, and, it's going to go.
It's time. It's time for the revolution. James, thank you.
All right.